Flesh-eating bacteria, just the name alone sounds terrifying, and for good reason. These infections are aggressive, fast-moving, and can destroy tissue within hours. Left untreated, they can lead to amputation or even death. But what exactly causes this deadly disease? How do you recognize the warning signs? And most importantly, how can you protect yourself? Stay tuned as I break it all down. Flesh-eating bacteria cause a devastating condition known as necrotizing fasciitis, which rapidly destroys skin, muscle, and soft tissue. These infections cut off blood supply, causing tissue to die at an alarming rate. Without urgent medical treatment, the infection can spread within hours, leading to organ failure, amputation, or death. While several bacteria can trigger necrotizing fasciitis, some are more aggressive and life-threatening than others. Here are the 5 most notorious bacteria responsible for flesh-eating infections. Number 1. Group A Streptococcus, gas. This is the most common and deadliest cause of flesh-eating disease. It enters through cuts, burns, or surgical wounds, releasing potent toxins that destroy tissue and cause toxic shock syndrome, leading to multi-organ failure. Immediate surgery and IV antibiotics are critical for survival. Number 2. Vibrio vulnificus, a deadly marine bacterium that thrives in warm seawater. It infects wounds exposed to saltwater or spreads through raw shellfish consumption, especially oysters. Once inside the body, it triggers blistering skin lesions, rapid tissue necrosis, and septic shock. Number 3. Clostridium perfringens. This bacterium is commonly found in soil, sewage, and decaying vegetation. It thrives in low-oxygen environments like deep wounds, leading to gas gangrene, a deadly infection that causes severe pain, gas buildup, and tissue death. Without immediate treatment, it can lead to fatal sepsis. Number 4. Staphylococcus aureus, including MRSA. MRSA is a drug-resistant superbug that spreads through contact with contaminated items and can be found in contaminated, high-touched areas in a community or hospital settings. It causes rapidly progressing infections, abscesses, and necrotizing pneumonia. Because it resists many antibiotics, treatment is often difficult and can lead to life-threatening complications. Number 5. Aeromonas hydrophylla. This freshwater bacterium thrives in lakes and rivers and infects wounds from floodwaters, fishing accidents, or aquatic sports. It releases toxins that rapidly break down muscle and skin, making early diagnosis crucial. Delayed treatment increases the risk of severe complications. Flesh-eating bacteria don't appear out of nowhere. They invade through breaks in the skin. Here's how they get in. Minor cuts and scrapes. Even a small wound can allow bacteria to enter. Surgical incisions. Post-surgery infections can turn deadly if untreated. Burns and insect bites. Any break in the skin increases risk. Tattoos and piercings. Poor hygiene during these procedures can introduce harmful bacteria. People with weakened immune systems, diabetes, or chronic illnesses are at an even higher risk. Recognizing the symptoms early could save your life. Watch out for these warning signs. Severe pain that worsens quickly. Pain is far more intense than expected for the wound. Redness and swelling. Spreads rapidly beyond the original injury. Blisters or blackened skin. A serious sign of tissue death. Gangrene. Fever, chills, and dizziness, indicating a systemic infection. Skin that feels warm, tight, or hardened. The infection is spreading deep into the tissues. If you notice these symptoms, seek emergency medical attention immediately. This infection can become fatal within hours. The best way to avoid flesh-eating bacteria is through proper hygiene and wound care. Here's what you can do. Clean all wounds immediately. Wash cuts with soap and water. Keep wounds covered. Use clean, dry bandages until fully healed. Avoid swimming with open wounds, especially in warm seawater or freshwater lakes. Practice good hygiene. Wash hands regularly and avoid touching healing wounds. Seek medical attention for infected wounds. If pain, redness, or swelling spreads rapidly, don't wait. Taking simple precautions can drastically reduce your risk of contracting this dangerous infection. Flesh-eating bacteria may be rare, but when they strike hard. Knowing the risks, recognizing symptoms early, and practicing proper wound care could save your life. Now it's your turn. Have you ever heard of a case of flesh-eating disease? Comment below and let's raise awareness together. Like, subscribe, and turn on notifications for more expert insights on infectious diseases and public health. Stay safe, and I'll see you in the next video.